So today we are going to speak about the role of robotic assisted surgery in the removal of fibroids in the uterus. Now first of all, what is a fibroid? Many people, around 20 to 25% women, present today nowadays with a solid ball-like tumor in the uterus. If this is your uterus, then there are solid ball-like tumors which arise in the uterus. These tumors are called fibroids. They arise from the muscular layer and generally they are non-cancerous. So if they are non-cancerous, then why we are talking about fibroids? Because these tumors can grow in size and become large. There may be multiple tumors, they may be located in different areas and they may be causing so many problems to the person. Now what problems can this cause? Fibroids, when they are multiple or they are large, or if they are located more towards the cavity of the uterus, inside the body of the uterus, they can cause first pain during your cycles. It can be really painful for the 5-6 days or throughout the periods. Second, it can cause a lot of bleeding. So that bleeding and blood loss can continue for 15-20 days and there can be anemia and for the patient. And third is that if the fibroids are many and located in different locations, sometimes it may also be a cause of infertility. It becomes difficult to conceive, and sometimes even after conceiving, some fibroids which are more towards the inside of the uterus can cause miscarriages. Now coming to the treatment of fibroids, there are 3 types of treatment. First is medical management, second is something called uterine artery embolization, and third is obviously surgery. Now medical management for such kind of tumors which are solid is only temporary. It can at least shrink the tumors a little bit, but when you stop the medication they can again come back to the same size, or sometimes they are not able to prevent the bleeding and the pain because the fibroids have grown very large. Now there is another option called uterine artery embolization, wherein sometimes we block the blood supply to the fibroids hoping that it will shrink. And the third and the permanent cure of fibroids is obviously surgery, where you remove the fibroid and you preserve the uterus. If a patient is desirous of childbearing and she feels that the fibroids are hampering because they are large and they are multiple and it is very difficult to conceive, then in that cases we offer them to remove these tumors before the pregnancy. Now how can we remove the tumors? Obviously traditionally it was the open approach, whereas we used to open the abdomen and cut open the abdomen, remove the tumors, but that causes a lot of post-operative pain. Patient gets back to the family with difficulty, loss of working days, and so now minimal invasive is the treatment of choice. Now minimally invasive is where comes into role laparoscopy and robotic assisted laparoscopic myomectomy or removal of the fibroids. Now with the robotic platform, because the fibroids are large, they are multiply located and sometimes they are located in such abnormal positions where it is very difficult for us to reach with other platforms. But with the robotics, the blood loss is reduced, the number of fibroids that can be removed is, all the fibroids can be removed with ease, and the patient can go back to normal work almost immediately within 1 week, because the patient can be discharged from hospital very early. Now this robotic platform, how does it help us? It gives us better vision, it gives us more arms. Robotic arms are 4 in number. We can approach these fibroids, and also for patients who are planning to conceive in the future, it is very important that after removing the fibroids, the uterus is repaired and refashioned in a proper manner so that it can take the impact of a future pregnancy. And in this case, the robotic suturing technique helps a lot in giving better outcomes to the patient. So in conclusion, robotic platform is an established technique that helps me overcome my boundaries or limitations of a open surgery or a laparoscopic surgery where it is difficult to work in confined spaces or use instruments where the fibroids are large and multiple, and it helps me to overcome these difficulties and give us exact precision and do the surgery with ease.